Let's go ahead and get started. Hello, everyone, and welcome to another edition of Transitions of Careers, Clinical Edition. I'm really honored to be hosting another TOC joint, and I just want to let everyone know, like, clinical pharmacy is really special to me, and so I'm really excited to have such a wonderful panel of women on this panel, especially Black women. And we can all tell our stories and how we transition in and out of clinical pharmacy. So let's get started. So pretty much this webinar is focused on people who are already interested in clinical pharmacy. If you're not interested in clinical pharmacy, you may be interested after this webinar is over. So if you're looking to make a career shift, you're at the right place. So stay tuned for tips and advice on how to transition careers in and out of clinical pharmacy. So let's meet our panelists. So first, Dr. Laurie Gordon. Laurie.
Hi, good evening, everyone. I didn't know I would be up first, but really happy to have you all joining us this evening and looking forward to a really great interactive discussion. So my name is Laurie Gordon. I currently live in Brooklyn, New York. I'm originally from Florida. I went to Florida A&M University, completed 2 years of residency training with a specialized focus in infectious disease and HIV and hepatitis C. I also completed fellowship training at the National Institutes of Health, focused on HIV clinical pharmacokinetics. I first started my career after postgraduate training as a clinical assistant professor at Xavier University of Louisiana's College of Pharmacy, and also maintained a clinical site at one of the Ryan White clinics in New Orleans. And then following that, I actually have made a transition to industry. So as you can see, I'm currently a global scientific advisor for ViiV Healthcare. And prior to that role, I served as a medical science liaison, so as part of the field-based medical affairs team. So happy to have this discussion tonight.
Thank you so much, Dr. Gordon. And thank you so much for being on this panel. And next we have Dr. Lewis.
Didn't know I was next either. Good evening, everybody. My name is Martienne Lewis. I am a mental health clinical pharmacy specialist at the North Texas VA. So starting out in my journey, I went to the wonderful school of the Prairie View A&M University outside of Houston, Texas. Did my undergraduate there, double majored in biology and chemistry with a minor in business. Then I went on to pharmacy school at the University of Incarnate Word. After that, I actually went into retail pharmacy management with Target Pharmacy, practiced there for a little bit before I went into residency. I did an ambulatory care-based residency program at the Phoenix VA. And then I completed my second residency year specializing in psychopharmacology, AKA psychiatry, at the Denver VA. And after that, I have been at the North Texas VA practicing in the Fort Worth outpatient clinic since.
Thank you so much, Dr. Lewis, and thank you again for being on this panel. And next we have Dr. Lipscomb.
Well, thank you for giving me the sneak peek so I could know I was next. My name is Dr. Justina Lipscombe, and I am currently I'm a clinical assistant professor at the University of Texas at Austin. I was born and raised in Las Vegas, Nevada, went to undergrad at Texas Southern University. Following that, I went to pharmacy school in Henderson, Nevada at Roseman University. Following graduation, I actually worked in retail for about 5 years and landed a job after retail at Cape Fear Valley Medical Center in Fayetteville, North Carolina, and decided to pursue a residency following, all of my clinical skills that I had attained from working in the hospital setting. And thankfully they took me on. I did my PGY2, at the VA here in San Antonio, Texas. And following my PGY2, I was lucky enough to land a job with the University of Texas, where, as I mentioned earlier, I now serve as a clinical assistant professor. So.
Thank you so much, and thank you so much for being on this panel. Next, Dr. Onye. Oh, I think you're muted.
Okay, I was gonna say someone needs to unmute me. Hello, everyone. Once again, thank you all for being here. My name is Onye Ononogbu. I am currently a research assistant professor at the University of Houston. My journey actually started out, I did my undergrad education at the University of Connecticut. We are 2004-2014 men and women basketball champions. That's neither here or there for this conversation. And then from undergrad, I actually took a year off. I worked in an HIV clinic, and that's where I kind of grew a passion for infectious disease at the time. And then I went to the real HU, Howard University, for my, you know what? I skipped pharmacy school. So I went for pharmacy school. I went to the University of the Incarnate Word. Fun fact, Dr. Lewis is actually my classmate, and we work closely together now. And then after pharmacy school at the University of Incarnate Word, which I loved my tenure there, went to now the real HU, Howard University, for my residency. I did a PGY1. I didn't do a PGY2. I see in the comments, someone said, nope, Hampton. Okay, you know, I'm not gonna argue.
We love
But so after Howard, I got a job at Starr Washington Hospital Center in DC, worked there for a couple of years as a clinical pharmacist, kind of worked my way up the ladder. And when I was in residency, I took a oncology rotation for an elective, and I actually switched my interest from IB or HIV to oncology. So after working for a couple of years as a clinical pharmacist in oncology at MedStar, I got married, moved to Houston, and worked at Baylor St. Luke's Medical Center as an oncology clinical pharmacist as well. And then I transitioned to Harris Health System as a hematology oncology clinical pharmacy specialist. And recently, once again, my new job is a research assistant professor, transitioned to a research assistant professor at University of Houston. Thank you all for being with us.
I mean, I just have to mention, though, that the only HBCU really worth mentioning is Florida Agricultural Mechanical University.
Oh,
on the highest 7 hills in Tallahassee. So.
I love the HBCU love. I love it.
Oh my goodness. Thank you so much, Dr. Onye. And I'm not looking at the chat right now. Whoever mentioned that Hampton University is a real HU, you are a real one. Okay. Let's see. And of course, there's yours truly. So today I will be hosting and moderating this wonderful panel of wonderful women on this panel. I'm really proud of this panel, actually. But today, I'm Dr. Starr Shands. I am currently a clinical pharmacy specialist at Gallup Indian Medical Center under Indian Health Service. I work for the Department of Health and Human Services. So my journey started, I was a pre-pharmacy student at the illustrious Hampton University in Hampton, Virginia. And I did 6 years there. I did 2 years of undergrad and 4 years of pharmacy school, and I graduated in May of 2018. I was an intern for Walgreens for 3 years in pharmacy school. I left at my year mark to pursue ambulatory care at Gallup Indian Medical Center. So I've been here for about 18 months. Currently, I work in outpatient ambulatory care. I work in central mail order pharmacy, as well as I have a focus in anticoagulation. So that is a little bit about my journey of how I went from retail to clinical. And let's get started with asking some questions. So we will start. It's our wonderful panel there. So let's discuss transitioning in your career. If you are a student, this is something good to listen to, as you may you may not see yourself working in just one area in pharmacy. There's nothing wrong with going from one area to another. Because as millennials, I'm definitely a millennial. I love doing different things. So if that applies to you, listen up. So I'll start first. What made you want to work in clinical pharmacy? And I'll direct this question to Dr. Lewis.
Oh, okay. Um, so first off, I don't like to distinguish a difference between clinical pharmacy and retail pharmacy. I think how you practice is how you practice. And I think you should, as long as you're putting your patient first and you're acting from a clinical standpoint, using your clinical knowledge and using all of your education and all your money at school loans to work, I think you can be a clinical pharmacist. You're well equipped to be a clinical pharmacist in a retail setting if time allows it. So I'll just kind of say that off the bat. I think what motivated me to go into a more clinical practice outside of retail is one, just my own passion and goals. I've always had a love for mental health, and I couldn't really pursue that in a retail setting. I would get a little glimpse of it, but I couldn't do what I wanted to do with it. And I would see things that I knew I could help. I knew I could impact their medication regimen, provide them with some good clinical pearls and kind of get them some good helpful hints, but I just wasn't in the setting to do so. And so I just felt very restrained. But that was always my passion to do more. So it never really went away. I just wanted to be in that setting. So I couldn't do what I needed to do in retail setting. That's the best answer I could say. So I know if I wanted to do more, I had to go elsewhere.
It's definitely understandable. And thank you so much for answering that question. And for me, I'll actually chime in with that. For me, what made me want to more so go from a retail setting to a more clinical setting was I love to talk to people. I really love to talk to people, and I felt I could do that in retail, but not to the extent that I wanted to. I wanted to like talk to little old grandmas who wanted to show me pictures of their grandkids while telling them all about their medication. I wanted to really like get into like what are the issues that patients are facing when it comes to their medication, and basically letting me in so that I can give them a solution. Basically, I wanted that one-on-one, and I felt like I could do that in an ambulatory care space because there were aspects of retail that I loved. Like I loved working directly with patients. I loved being in direct patient care. Like I love that. And I just felt like there were different things that I wanted to do. And I felt that I could do that in ambulatory care. So I feel like I'm doing that now. And I'll actually direct this question. I do want to hear another.
Okay, if I just,
Oh yeah, please, Dr. Gordon, please.
I just wanted to underscore what Martine said. It was something I often shared with students when I was teaching. What you said as far as practicing clinically everywhere is so important, right? You know, we leave school with a doctorate of pharmacy, and you know, in my HIV clinic, for example, I might touch, you know, a very small set of patients. If you're in a community pharmacy, you're touching, you know, thousands of patients' lives each week. And so I really want to underscore how important, no matter where you are in your career, for us always to remember that we are practicing clinically. We're part of the clinical care team. So I really just wanted to underscore that.
Thank you so much, Dr. Gordon. And I would like to direct this question also to Dr. Lipscomb as well. Sorry, put you on the spot.
No, it's all good. But I agree with what both Dr. Lewis and Dr. Gordon says. I think one of the reasons why I wanted to kind of go into a more clinical role was also to be able to fully apply some of that knowledge. So I think for me, one of the biggest things that I noticed in the retail setting was you get the prescription, but sometimes you don't have the full information you need. And I felt sometimes like you know, this might not be the best, but I don't have anything to really back it up for my patient. And so things like that really pushed me into wanting to go more into a hospital setting or a clinical setting or whatnot. I will give props to retail pharmacists all day, and we need retail pharmacists, and I think they are some of the best pharmacists that I've ever worked with. So I don't want to take any, you know, credit away from them, but I think that was my main driving force into going into a more clinical setting.
Thank you.
Also, too. Oh, sorry.
Oh no, please don't. I was actually going to ask you next.
Yeah, I think so. You all did ambulatory care, right? I think out of all of us, I think I did. I did inpatient, and so for me, I loved the thrill of literally rounding with a team every day and seeing something different every day. You know, we had patients that they would come in and have a diagnosis that I've never seen before, or they'll have a whole bunch of drugs on their medication. I'm like, wait, why do they have that? That's like a duplicate therapy. So it was the thrill of rounding with the team, you know, talking to patients, also learning from the team. You learn a whole bunch of knowledge when it comes from when you see a patient with a team of physicians, nurses, the knowledge from different different practitioners is, you know, invaluable. So I love that part about clinical pharmacy.
Thank you so much for your answers in regards to that question. My next question would be, what made you want to transition in your career? And this question is directed to both Dr. Gordon as well as Dr. Onye.
Want me to go first, Dr. Gordon?
Yes, please.
Oh, okay.
Go ahead, yeah.
For me, I'm a huge believer in setting up goals, right? Long-term goals, but in addition to keeping my options very open. I've been like that since I was in undergrad. I wanted to make sure that I knew I always wanted to be a pharmacist, but I wanted to make sure that I would have the opportunity to do different things in pharmacy. So in the past, I'll say 5-6 years, I've just been, I got an informatics certificate because I was like, you know what? I deal with computers all the time. I deal with electronic medical records, especially being in oncology, you know, and I was like, you know, let me see, what else can I do? What else can I got a teaching certificate when I was in residency. I wanted that option just in case I wanted to eventually get into academia. But I think for me, with being a co-founder of Pills, the passion that, you know, the co-founders had and the current e-board have of just mentoring students and knowing that I didn't have that in undergrad and in pharmacy school, I knew that, you know, me going into academia was something that eventually I had to do. And this opportunity really just fell in my lap. But guess what? I was prepared for it because I had made sure that I did my teaching certificate. I made sure that I was being an adjunct professor at DTSU. You know, I made sure that I was, you know, making sure I was keeping up my skills up to date and up to par before any position allowed itself to come to me. So I transitioned because I knew, you know, you always know when it's time, right? So being a specialist was one of my goals. I hit my goal. Then what, right? So I hit my goal. I was there for a couple of years. And then I was like, man, it's time for me to move forward and move on. And so academia was definitely that next step for me.
It's interesting because I kind of think about transitions. Well, I guess I moved through my transitions very differently, meaning the only thing that's ever guided me in my career is I'm very passionate about HIV pharmaceutical care. You know, that was established for me during pharmacy school, and everything I do, you know, works towards that. So from that aspect, you know, I share with you, Onye, as far as long-term goals. But, you know, it's surprising because I'm a very type A personality. When it comes to career transitions, I actually am very just fluid. You know, I think, you know, being open to opportunities is like super important. Having a clear vision of like what you're passionate about, I think is super important. But other than that, I'm just open. And if I'm not happy anymore, for whatever that reason may be, that's really been the impetus for a transition. I do think that, yes, you need to plan along, you know, in your career, but I also think that, and I think this is, you know, especially true for myself as, you know, everywhere else in her life, being very like things need to be in order. I have found that each time that I have made a transition, it wasn't necessarily I had intended specifically for that transition. I found myself in a place where I kind of was unfulfilled, and then I just, had an opportunity present itself, and I weighed, does this make sense, or does it not make sense? I'm having like tech issues here, sorry. Does this make sense or does it not make sense? And just kind of went with it. So I agree with you, Onye, as far as, yeah, have a plan, but I also want to just encourage, as you're thinking about transitions, just trust that, pharmacy is a career that allows you that degree of flexibility, that you can actually allow things to kind of come your way. Just make those connections with people, and actually, like, the opportunities to transition, I think you'll find will kind of fall in your lap in a sense, and you just have to choose whether or not it's the right time, the right fit, and those type of things.
No, Dr. Gordon, I totally agree with you. Trust me now, I don't want nobody going to my LinkedIn and be like, man, she got like 15 jobs, because I had a lot of jobs now, so I'm fluid. So I actually totally agree. It's what I was actually trying to say is, me, I have long-term goals that I wanted to reach once I reach them. And every job that I had, or every new job that I jumped to, was for a new opportunity, and actually a better opportunity. There were jobs that I weren't happy with. So I'll say, but for me, I would stay in a job until I had that next opportunity that I wanted to jump to. So I would say that would be my only difference. But yeah, listen, if you go on my LinkedIn right now, okay, honey? But yeah.
Yeah, I echo both of you guys. There's so many things in pharmacy, right? But when I think about transitioning to other positions, when I have my residents on board and my students on board, I mentioned to them job security. And just to go on a whole nother level, there's so many pharmacy schools, we have so many pharmacists coming out. So on day one, you want to do something that sets yourself apart from everybody else. And you don't want a new pharmacist to come up and take your position. I mean, granted, we have to all move on, but you want to set you up with certain skills and certifications and networking experiences where if you do want to move on to another position, you're qualified, like Dr. Onye said. Take advantage of opportunities, things that you may not necessarily be interested in, take advantage of those, because that may be a job in about 2 years just because you took that webinar with that certain person and got that certification. So you never know, with medicine forever changing, you always want to make sure you're set up to move on if the opportunity arrives.
Absolutely. And to kind of piggyback off of that, one of the reasons why I ended up in the hospital setting was because of networking, speaking to people, and ending up in a position that I did not necessarily, I wanted to be in it, but I didn't necessarily think I would get there. But joining, organizations, ASHP, whatever, TSHP, whatever organization in your state, being involved is a big thing, in putting yourself out there, speaking to people, forming those relationships, listening to what people have to say, because I think sometimes we don't, we hear things, but we don't necessarily take the opportunity or take the opportunity when that window is open. So thinking outside of the box and taking opportunities is the big thing.
Thank you so much. And Dr. Lipscombe, you actually segued into my next question, but definitely echoing opportunity. You have to jump on opportunity. If you have the feeling that something needs to change, listen to your intuition. But the next question is, how did you utilize your network to help you transition to a new career? Anyone can take this, because I feel like everyone on the panel has something great to say about that. So you can go first, Dr. Lewis.
And I'll take that just into a position that I'll be starting soon. So, and I tell my residents and I tell my students this: you see a person and you see what they're doing and you want to do it. Instead of trying to Google and try to create your own path, speak to that person and ask them what they did. Like, it's a conversation. Take skills and tips that they have, and then kind of work backwards. Okay, I'm at this point. I want to get to this point. What do I need to do to get there? And learning and speaking to other people and doing those steps. And you may do something differently, and that's completely fine. but it's good to have a game plan. It's good to have some type of map to work off of, and then create your own path. But you have to find out where you want to be instead of just kind of going in the dark and kind of just guessing, like, I know I want to do this, but I don't know where to go. Like, find somebody who you want to be just like and just ask them, what do I need to do what you do? What do I need to do to take your job? Like the job that I'm about to start, I asked the person, I want your job. What do I need to do?
And the thing is, like, no one so myself, meaning anybody who's ever asked me, like, oh, Laurie, like, what do you do? Or when I have gone and said, hey, I'm interested in this, I've never had a door shut in my face. People love to be able to share their journey, from top to CEO, So I definitely totally 100% agree. Just go straight to the source. People are usually, I've never had an experience where someone was not happy to help.
You'd be surprised. Some people will say, well, I'm about to quit in 2 years, so just let me know. You never know.
Under my wing.
And I would say too, just to back that question up a bit, because I know Xavier just asked that, but what does your network look like? That's number one. Like, do you network at all? To even have a network to, because I'm not gonna lie, literally all my jobs came from somebody I knew. And I can go down right now. After residency, we had a meet and greet with my residency director and some of his friends that are in the field of pharmacy. From that meet and greet, I landed my first job at MedStar Washington Hospital Center when no one was landing positions there, because he went and spoke to my direct manager. When I left MedStar and jumped to a hospital in Houston, guess what? The residency, the admin resident was Josh Blackwell. Y'all all know Josh. He's also a co-founder of Pills. And he got me in. He tried to get me in PRN. They hired me full time. Then after that, after getting to know people in this Houston hospital, I rounded with a team of physicians. The physician were good colleagues with the MD Anderson physicians at my current hospital, spoke to them and was like, oh, she's great. You should definitely, have her on your team. And that's how I landed that position. And then crazy enough, the pharmacy director at one of the Houston hospitals that I worked at now left and went to University of Houston. And she remembered, my passion for students was like, listen, this role is yours. And so that's how I ended up with my role. So networking it's not even about how to use your network. Who is in your network? And are you networking the appropriate way? People say, well, how do I network if I'm not like an extrovert? The reality is networking starts from before then. Like, your classmates can be your boss. Like, Ryan Saki, who is the CEO of Pills, was my student. You know what I mean? Don't look down on people under you either. And that's the huge thing I always preach to people is like, you never know who's going to be your next opportunity to get a job. And networking is key because someone will rather take someone they know versus someone they don't know. It doesn't matter if you could have even more credentials, but if someone is vouching for someone and they trust that person that's vouching for that person, you're going to get that job. So networking is super key. And, stay in touch, build relationships. I know everybody's not an extrovert, but, try to challenge yourself and get to know people. So I would definitely say that.
Thank you so much.
Oh, to kind of go, sorry. To kind of go off of that, networking is definitely key. And then being an advocate for yourself is another thing to kind of keep in mind, because even for me, like I said, I did my residency where I worked. And when I decided that I was going to apply for residency, I talked to some of my supervisors and I kind of brought up the idea and they were like, well, we've never had anybody do that. And I was like, well, is it against the rules? And essentially they were like, no. So I said, okay, well, this is what I'm going to do. So speaking up for yourself, advocating for yourself and taking risks. I'm very much so introverted. I'm a shy person for the most part. I think I'm slowly growing out of that. But, taking yourself and putting yourself in, stepping out of your comfort zone is something that is definitely key when networking. Talking to people that you normally would not talk to is key. So.
And I think sometimes, because even though I'm an extrovert, I would say like, if you ask people who are close to me, like I feel very awkward, like trying to network, I'm like, if I don't have like a reason why, I'm going to be building a conversation, I get super awkward. But I think it's because we sometimes make it bigger than it needs to be. usually just one question is all you need. And that one question is usually something very genuine. You know, I see you do this. I'm curious how you got there. That's all you need. You don't need, I know a lot of times as mentors, we do tell you all like, okay, think about these questions and things like that. But all you need is really just one question. As I've transitioned to my current role, I was talking with my manager. I am having super computer issues tonight. I'm sorry. I was talking with my manager, and he was encouraging me again to like be networking. I'm trying to meet people globally across the company. And he said, it's one simple question, Laurie. In your role, what are your expectations for me, or how can I best serve you? And literally that has guided all of my conversations. That one simple question. We don't have to over prepare to network. Just come with one question. Again, I think people are happy and ready to share, and that's what networking is kind of about, is, sharing experiences, because the same way you're thinking, oh, can this person help me? Again, like, how Justina said, or I think maybe it was Martienne, they might say like, actually, you're helping me because I was trying to get out of this, like, so you just never know, like, and just don't overthink it. That's what I would say,
I agree, and I echo all of those points. For me, my first intern job, my classmate put in a good word to the pharmacist who ended up being my pharmacy manager. Like, she just straight up asked, like, she saw my application and she saw that we were in the same class. She was like, "Is Starr a good person?" And she's like, "Oh yeah, she's great." If she had said something bad about me, I promise you I wouldn't have gotten that job. Like, and even when it came to, I wanted to work for Indian Health Service, I hit up all the alums from Hampton who were either working for IHS or who had experience with IHS. I found everybody's LinkedIn, everybody's email. Somebody was getting a DM. Like, it, I was like, no, like every contact that I have, you're getting something from me. And it really is as simple. People really do love to share. People love to pay it forward. And I didn't realize how much until people were in the position to help me. And then when I got to my position, I found myself being on the receiving end of LinkedIn DMs and emails saying, "Hey, I see where you're at. How did you get there?" And less than a year before, I was that person saying, "How did you get there?" It really is that simple. Like, and I didn't think it was, because it's not all these different algorithms that you have to go through to see somebody. You see somebody in a powerful position, it's not like, oh, I have to go through all of these hoops and jump through all that. No, reach out to them in a professional manner and just ask your questions. And it really is something to keep in mind. So thank you so much for all of your points. I'm trying to, oh my gosh, I'm attempting to look at the chat, and there's so many wonderful questions in here. Okay, so thank you so much for everyone who is putting in questions in the chat. So we actually do, it seems, okay, so we have an international student. As a pharmacy student in Europe who doesn't have opportunities for clinical pharmacy practice, but only community pharmacy practice. So you only have opportunities for clinical pharmacy practice, but you only have community pharmacy practice experience. Are there things I should be doing to be at an advantage before applying for residency in the US after pharmacy school?
I'm not an international student, so I'm just going to give some general advice. If you're wanting to apply to residency programs, I think the first step is contact those residency programs and see what's necessary from being an international pharmacy student, and see what the qualifications are for that particular residency program, and then go from there.
Yeah, I agree. I have a friend right now who actually transitioned from the US to UK as a pharmacist. And I know that they're very different in terms of the experiences that they have in the UK and the US. So I totally agree with Martine. If you are interested in doing residency in the US, reach out to the programs that you're interested in and see if they have any advice on what you should do in terms of building your resume to apply.
And not only building your resume, but also thinking about your qualifications to sit for the boards and licensure, because I know sometimes that can deter residencies.
So next question, I love this question. Let's start early. Do you have any tips for incoming P1s in regards to being successful with mentoring? Let's start early.
Justina?
Yeah, so I would highly suggest your P1 year. Number one, start early, start networking, speaking to upperclassmen, speaking to faculty, you know, kind of getting advice on what you can do to be more marketable as a residency candidate. My other piece of advice would be to start joining organizations, being involved. And I know it's kind of hard with us being in the COVID atmosphere right now. But, you know, trying to, again, get involved with organizations, thinking about different leadership positions that you can do, thinking about if you want to do research. So, you know, what type of research opportunities can you be involved with early on? And then just speaking to faculty, thinking about what different pathways, you know, faculty, or not even just faculty, but other pharmacists have taken to become successful. So those would be my pieces of advice. Yeah.
So since we're on the topic of P1s, a question.
If I could just add one more thing.
Okay.
Never forget why you went to pharmacy school. Have a competitive GPA if you can start early from P1, because there are programs. I mean, I just, you know, keeping it real in a sense, there are programs that GPA is the first way they cut their applications down from, you know, 100 to 50, you know. So make sure you have a competitive GPA if you can, you know, do that. Along with everything that Justina said, to be a superstar.
Let's see. So since we're on the topic of P1s, what jobs would you recommend for incoming P1s interested in clinical pharmacy? Let me just chime in. So my mentee, my long-term mentee at this point, we are actually coworkers at Walgreens together. And she ended up getting a job at a local hospital at the same time. And I was like, wow, her time management skills must be A1, right? But she was doing it. And I think if you can get a pharmacy intern position at a local hospital, I think that'd be great, somewhere near your university. I think retail is a great way to start. If you want to get a pharmacy intern position at a Walgreens, a CVS, a Kroger, or Rite Aid, what have you, start there. If you can segue and use that experience that you got at your retail pharmacy intern position to go into a hospital, that would be great. And I thought it couldn't be done. It can be done. And I was proven wrong. It can be done. So no matter how early, you can do it. So
yeah,
that's my answer to that question.
I mean, I didn't work in a hospital in pharmacy school. I worked in retail all throughout pharmacy school, and I didn't feel less than or incompetent with a retail pharmacy experience. I think it's what you make from your experience. Like when you go to work, are you just kind of being another technician and just doing the job and going through the motions? Or are you actually trying to learn from the pharmacist and working next to them and really trying to make those interventions that you can use during interviews and use during conversations and use during providing patient care? Like, you want to utilize the experiences that you have. It's not so much hospital and retail. Granted, people want hospital experience, but in a retail setting, I think I had a lot of clinical opportunities because I took advantage of those interventions.
And never forget, I mean, you're going to have clinical, you know, IPPs and APPs. So really engage. And again, going back to what we've already discussed, network. Same thing, Justina mentioned organizations, super impactful experiences I had were summer internships, which were actually some of our PhD professors had written for grants, and they were grants focused on inspiring students and things like that. So, networking with your faculty, engaging fully in your curriculum, which includes, those clinical experiences, and also maximizing your work experience, whether it's hospital or a community. Similarly, I had no community experience, and this is somewhat tangentially related, but I work in industry now. I had no appies that were industry, and I was actually upset my last year of pharmacy school. I was like, I need an appy in industry so I can know. You can make your plans, but as I said, opportunities will present themselves. Just, keep that focus on kind of what your overall happy vision is, and I think things will turn well.
Yes. IPPs and appies. Oh, sorry.
No, go ahead, Starr.
So IPPs and appies are super important. I've had a good number of friends who have gotten jobs from their appies post grad, like top of the line jobs. Like we're talking like straight out of school, inpatient jobs, straight out of school, like clinical pharmacy specialist jobs, like straight out of school, like working for like a VA somewhere. Like you can get a lot of opportunities post grad with your appies. So that is extremely important. I have used recommendations from my preceptors on my appies to land my current position. And keep in mind, my current position came a year after I graduated. So please keep those connections. Just putting that out there. Dr. Onye, you had a point you want to make?
Yeah, I was just going to say, most programs in general are just going to be looking at your entire package anyway. So they're not going to say, oh, well, this person did retail, but this person did hospital. Some programs may, but most, they're going to look at the whole package. So, definitely try to get the most of the experience that you can, but make sure that, just like Dr. Gordon said too, try to keep your GPA up if you can. I don't even know why we keep saying if you can. Just try to do it, okay? So, try to do it. That's it. Try to do it.
That one class, you're like, oh yeah.
Exactly.
Chemistry was
right. Just try your best, but
try. Let's just try. And wonderful that we are talking about appies, because we got a wonderful question saying, what words of advice would you all give to a rising P4 student who is trying to decide what type of residency program they are in? Quick shout out to Chandler for doing such a wonderful job in this chat. I just happen to be like scrolling every now and again.
Thanks, Jan. For P4 students, again, same thing, networking, speaking to your preceptors, finding out what their journey was. And just keep in mind, just on appies in general, these are their interviews. So putting your best foot forward at all times is important. So again, networking is the biggest thing, keeping in touch. And I know there was a question in the chat about what does it mean to keep in touch? It can be something as simple as, if you're on, I don't know, I'm old school, so I use Facebook. I haven't gotten all into the Instagram just yet, but I can't figure it out. But even if it's something as simple as just, wishing somebody a happy birthday when their birthday comes along, or they post something, you say, hey, that's really cool. Like those little things go a long way in keeping in touch. So that's my piece of advice.
Mm-hmm.
That's crucial. Go ahead, Onye.
Go ahead, Dr. Lewis.
That was really important for me, going into retail pharmacy and then applying for my residency program 3 years later. Like I had to stay in touch with people during those 3 years. And so doing what Justina said, reaching out to people, just saying hi, keeping them in the loop, telling them how work was going, tell them different things that I was going through. And sometimes I would know an answer, but I would just reach out to them and ask them a question just to get their thoughts on it. just to stir up conversation, commenting on baby photos. Like, you want to continue to have those little interactions here and there. You don't need to have an hour-long conversation every Wednesday at 7 p.m. It's nothing like that. You just want to make sure they do not forget you and they remember your name. When they see your name, they want to have good memories. They want to think happy thoughts. So it's the little things, but they come in handy when you need those letter of recommendations after 3 years after graduating. So.
Yeah, I mean, I totally agree. I think there was one residency program director that I loved what she did. I loved her research. I loved everything that she did. And I just kind of, I reached out to her one time and she was very nice and kind. And it wouldn't be every day, it wouldn't be every month, but anytime there was like an event, maybe we both went to an oncology event, I'll reach out, hey, how you doing? I kept in touch with this lady for 3-4 years, just randomly hitting her up. One time I hit her up like, hey, would you like to have lunch? She worked at the next hospital next to me. Would you like to have lunch and just talk? I want to let you know what's going on in my career. And she was like, yes. We sat down. When I tell you, before I landed the position, actually right after I landed my specialist position at Harris Health, she sent me an email saying, hey, there's a job at my hospital and I want to know if you're interested in. So this is something I never expected from her, but just keeping in touch. But going back to that question, a P4 job, I would say or what residency program to apply for, do research, because when I was a pharmacy student, I didn't know anything about industry. I didn't know anything about managed care. I didn't know anything about ambulatory care. All I thought it was inpatient, or that's it. So, I mean, times have changed since then now, but, do research about, there's so many different programs out there. And by now, by P4 year, you should have an idea of some certain things that interest you. You don't have to have one interest, like, oh, I know I'm gonna do a PGY2 in this, because, most PGY1s are general. So you should have an interest in maybe 3 or 4 things that you like, right? And kind of follow and see what programs fall into all of those interests that you have. And I guarantee you, once you do a PGY1, you're going to knock out maybe 2 or 3 of those interests and say, oh, I know I like this. So definitely do research about, which programs you're interested in or what types of programs. Maybe hospital's not for you. Maybe you may like ambulatory care. Maybe not. Maybe managed care. Maybe industry. Maybe fellowship. There's so many different opportunities. So.
And I'm a little bit out of the loop, but I think, if I'm not mistaken, ASHP has an online residency portal, so you can literally decide what's important to you. Maybe it's location. Like I was from Florida, so I wanted to leave, and learn about pharmacy in a different place, but I also knew I had networks in Florida. So I had some, well, if nothing else, I think this program will definitely, right? So you can search by state, or you can search by, the PGY2 specialties, for example, so you can see, is there a PGY1? If you want to do HIV, well, if they have a PGY2 in HIV, maybe they have a PGY1 also, and you can start at that. So that resource is really helpful. And, what Onye had talked about, for me, I wanted to be in academia. Okay, which of these programs have teaching certificates? If they didn't, I was like, little lower, these programs have good HIV clinical experience, even from the PGY1 level. So that portal is really helpful to organizing your thoughts, and then go to their websites, because you can find a lot usually at the program's websites as well.
Right.
And then also be open and flexible, I think, is a big thing, because even for me, I would have never thought that I would end up in San Antonio, Texas. If you would have asked me during my P1 year, would I be in San Antonio? I probably would have given you the side eye. But after going through mid-year, and my residency program director actually reached out to me. And I was like, okay, hey, I might as well go and talk to him. And I sat down with him and the then current resident, who happened to be Ashley Oliver, who a lot of you guys know, and who is probably now one of my best friends. But we all sat down together, and I remember leaving that meeting like, oh, this is where I want to be. So just having that open mind, thinking about, again, talking to people, not being afraid to talk to people, that will take you far. So.
And if I could touch this, I had kind of thought about this. I know it's a little bit not as directed to the question, but going back to how do you continue to keep in touch? mentors also like to celebrate you. So like if you publish a, article in Pharmacy Times, or, you passed your medicinal chemistry test and it's been a hard, send a quick note. We love to hear that as mentors, as far as like, hey, I just wanted to let you know, like, I was really stressed about this, but I got it done. And even those, so it doesn't have to be like, even, oh, I have a question for you, or, it can just be like, hey, I wanted to update you on my life, and just real quick. And that is a way to keep in touch. So I just wanted to make sure that was thrown in there, even though.
Thank you so much for all these wonderful points. Definitely more so to echo Justina's point, Dr. Lipscomb's point. It is crazy where you could possibly end up. On my rotations, I had an FDA rotation. I knew right then I wanted to work in the federal space, whether that was industry or clinical. I wanted to be in a clinical space. If you know me, I'm from the East Coast. I'm from Virginia. I am 804, born and raised. Like, I never ever thought I was going to leave Virginia, let alone the East Coast. And somehow I ended up in the middle of the New Mexican desert. And I love New Mexico now. I mean, no one knows where I am half the time. Everyone thinks I live in Arizona, or no one knows like what time zone I'm in. It's cool, but I never thought that I would end up in New Mexico, and my career took off on my own terms because I was willing to take a risk and move to somewhere I had never seen to do. Thank you. To do a job I've never done. So it's crazy, like, where you can end up, and you have to have an open mind. You have got to, everything that you think you may like, actually see if you like it. Your rotations will let you know if you like something. I thought I was about to be over here like internal. I thought I was gonna love internal medicine. I got on my rotation. It just wasn't for me. It was not for me. But I love ambulatory care. I love clinic work. So the two rotations I loved were my FDA rotation, the federal space, and I love my ambulatory care clinic rotation that was at this super small clinic. And I ended up working in a federal space in the ambulatory care sector. Keep an open mind, y'all.
Open mind. I think Dr. Onye is the testimony of having open mind.
I was just about to say,
oh my goodness.
Let me tell y'all, because sometimes I get bitter about it, but so y'all, people that know my story know that I was hardcore HIV specialist. I knew I was going to be an HIV specialist before I got to pharmacy school. Like, I already knew that because no one could tell me. And I met the wonderful Dr. Heilig, who that's networking. I met her at mid-year, and she kind of connected me to Howard, because Howard wasn't even on my list. And in DC, there's a high number of HIV. It's a HBCU. I was like, come on, I'm about to go here. And then they had an amazing rotation with one of the professors who people used to rant and rave about her HIV rotation. And then even in my interview, she was grilling me on questions. I was like, this is who I'm about to rotate with. Y'all, I get to my residency and something happened to the rotation. So there was no longer HIV rotation. I was devastated. I cried. I was, yelling and cussing. I don't cuss, just kidding. But I was yelling at my residency director, like, hey, what are we gonna do? Because I literally came here for this rotation. And he was like, choose an elective, just like that. And so I was like, what, like, this is my life. Like, I was national. I was repeating all my credentials to him, my HIV credentials. I was national SNAPA RTR chair. I was this, I was that. And he was like, you got to choose an elective. And y'all, I chose one elective in oncology, and look where I am today. It's mind-boggling. So
I remember that conversation, Onye.
I was like, we had the conversation. I was like, wow. We love to see a pivot. We love to pivot.
Even my professors to this day are like, Onye, what? You're not HIV specialist? I'm like, no, I'm oncology.
I had an oncology rotation, and that just cemented for me. I was like, oh no, I don't want to do this.
Absolutely
Steered me
not.
right squarely back into HIV.
Thank you so much for all these wonderful, oh, I love all these responses, and a huge, huge shout out to the wonderful Dr. Erica Heilig. She has been an inspiration. She's been on a panel for TOC before, and thank you just so much for inspiring. You continue to inspire, and clearly you continue to inspire the people on this panel. So thank you so much for the work that you've done. Just a quick
I just want to mention that Dr. Heilig is a rattler. I just want to make sure everyone knew. Okay.
Let's continue. Just kidding.
Oh.
Because you know Erica in the chat was going crazy with her little snake that she was doing. But just to add on to that, because Erica still needs to get props. Just to add on to that, Erica, Dr. Heilig, you know what I'm saying? I still call her Dr. Heilig. Dr. Heilig has been definitely an inspiration. Like literally, I looked up to her in my entire, like she was the epitome of like hard work. And so just have to give you kudos. All right, that's it.
We really do love to see it, y'all. We love to see it. Well, let's see what our next question is. I love this question. Hopefully this will be an inspiring question. I would love to direct this to Dr. Lipscombe and Dr. Lewis. How did you overcome obstacles in your journey on your career journey? How did you overcome obstacles?
So I guess for me, number one, again, networking was huge for me. But aside from that, I think I was actually in a lucky position, as I kind of spoke with you about this, Starr. My husband is actually a pharmacist as well. And so when he was graduating, it kind of worked out perfectly that he was graduating. So he was going to get a job. So now I can take that pay cut. And so that helped tremendously. But I went into that pay cut knowing that, I had to cut back on some things, knowing that, I had to do what I had to do for the next year or two, possibly, if I wanted to get where I am now, if I wanted to meet my goals. So that was number one. And then my other big obstacle was working with my colleagues. So now going from colleagues to a preceptee and, adjusting to that. One of the big things that I will say is sometimes you got to humble yourself and realize that the people that you're working with, they can offer you great things if you allow them to. So I think those were my biggest obstacles. And yeah, that's how I overcame.
For me, I think I overcame it by just remembering and staying true to my why and what I needed to satisfy myself, and kind of realizing and just looking at 10 years from now, was I going to be satisfied with what I'm doing today? And I knew I was not going to be satisfied. I am a true Gemini heart, like true and true. My mind changes all the time. I can go from one point to another point really quick. I get bored very easily. But really just understanding my why and what I needed to truly be satisfied. I was willing to take a pay cut. I was willing to go anywhere. I applied to residencies. First, I did apply to residency programs that had my interests, but I did not let location limit me. I applied all over the United States because I knew I needed to do a residency to get what I needed to do. So I just took a leap and said, it is what it is. I can go anywhere for 1 year. 1 year I can go anywhere, so let's just do it. The pay was hard. Good thing I have a lot of pharmacy friends who held me down. But, I just had in my mindset, like, you have to do this to be satisfied in your day-to-day. I was working with pharmacists who were literally miserable, and I just didn't want to be that early in my career. There has to be more. And so I just went out on faith. To get a little bit more spiritual outside of pharmacy, I had made a promise to my godmom before she passed. And, I said that I was going to do this. So nothing was going to stop me at that point.
Yeah, I would also just say, like, those that also know me know that I'm huge in my faith as well. Like, people will test y'all. I'm telling you, people will tell you that you're not going to be a pharmacist, you're not going to be a specialist. People will refuse to promote you, but I had to stay true to my faith and pray and know that, you know, with me having my faith, I knew that nobody, no human being can dictate my path. And I stayed true to that. I know what I'm going to do. I know what I'm capable of doing. I would say positive affirmations, you know, most mornings, not every, because sometimes you don't even want to get up. But I would make sure that I stayed true to knowing like where I'm headed. I know since high school, I always wanted to be a pharmacist. I finally became a pharmacist. I knew that I wanted to be a specialist. I became a specialist. I knew that I was going to work in academia. I'm in academia. I know where God is telling me that I'm going, so I'm going to stay in that mentality. So, you know, I had to really stay true, like, and to my faith and pray and make sure that when people come against you, you can't listen to their words, because sometimes you'll be like, oh, I don't care what they said, but it really goes deep if you allow it. So for me, people will refuse to allow you to you know, I'm telling you, they'll refuse to promote you, move you forward, but you already know what you're capable of doing. You just got to remember that.
I will say, and to echo you, Onye, like a lot of people were discouraging when I told them I wanted to go back and do my residency after doing retail. Little did they know that made me a awesome resident. Like I would not have been the resident that I was my P1 year. I mean, my PGY1, if I had not done a residency, like straight up. The experiences I had, the managerial experiences I had, the leadership experience I had, the multitasking I had, the hours that you do as a resident. And then what I did as a pharmacy manager, working 2 shifts with one technician that was incompetent, like I can handle anything. I can handle anything you throw at me. So I think that everything happens for a reason, and take those experiences and take that into your residency program. Like you're going to be working with people younger than you that you have experience on top of them. So don't look at them as like, oh, they're going to get it just because they graduated pharmacy school. No, you have more to bring to the table.
Absolutely. And then the other thing, not even on a residency note, but just in general, applications sometimes have these things called, what are they called? Like qualifications. Don't let that deter you. I think sometimes those are just there as fillers. But go ahead and apply. Like if you want the position, go ahead and apply. The only thing they can tell you is no. But at the end of the day, what's that saying? You're gonna miss 100 shots that you haven't taken.
Right.
Or something like that.
Listen, Justina is 100% correct. The job I have now said we are not hiring because of COVID. I still applied and they called me. So
take your shot. If you want that job, take it.
Yep.
Thank you, Xavier.
But yours sounded good too. Yours sounded good
too. We still love to see it. But yes, like it's very much important to not let things stop you. For example, for me, when I decided I wanted to leave retail, it was not a straight, like a linear path to my current position. I thought, you know, I was a good student. I did everything I was supposed to do, all of that. And, you know, I had good references. I had a good transcript from Hampton, blah, blah, blah. I was a new grad. And the first, I remember I had the exact number in my head. I applied in Virginia. I think I applied to 14 different positions just in Virginia. And this was less than 6 months after I graduated. This was around 6 months. I got rejected from every single one. And that hurt my pride. So like humility must be a virtue. And I remember saying in school, and I lost track of that thought because, you know, you think to yourself, oh, you can't do it. I kept telling people in school after I was done my FDA rotation, I'm about to have a government job. I'm about to get all these benefits. It's about to be bomb. Like it's going to be great. Okay. And I forgot about that until I was like, you know what? I'm not gonna let these rejections stop me. I'm gonna keep applying. And the bad part is I was applying to jobs that I wasn't even all that crazy about. I just wanted to get out of retail. So I was like, you know what? I might as well apply to a job I actually want. And then I started networking. I started doing all the same things I was doing in pharmacy school when I wanted or needed an opportunity. I reached out to people that I knew. And I even reached out to people that I didn't. And even on that journey, there were some interviews and may have fell short, there were some emails that went cold. Like, and then I kid you not, and I've told this story so many times, but I'll tell it again. I flew to New Mexico to do some site visits around Indian Health Service. I flew to New Mexico. I was visiting a friend who I met through networking. And I was ready to, I was like, I can move out here. This is great. The site I went to go see, they loved me. They weren't hiring for like another year. They weren't hiring. So I was like, you know what? This is my last shot. And that just got blown. So I got on a plane back to Virginia into a 12-hour shift at Walgreens. The one time that entire day, I just finished getting cussed out by a patient. And I managed to take one break to go to the bathroom. The director of the hospital I'm working for now called me and offered me an interview on the spot. And she asked, "Can you interview right now?" I said, "No, I'm at work." So we scheduled for a week later. At the interview, I thought the interview went okay, but it went like other interviews had gone in the past, so I wasn't hopeful at all. I asked her after the interview, how long would it take to hear back, just so I could brace myself. She was like, "It'll take about 3 weeks." I got an offer, a full-time offer in 9 days. So you cannot let rejection stop you. You cannot let cold emails stop you. You cannot let the job search will humble you. If you happen to be like me, I didn't go down the residency route. I went straight into the workforce after graduation, and I went into my clinical pharmacy specialist job here. Like, there will be people that will tell you you can't get anywhere without a residency. And me, some of my best friends are residents. Some of my best friends have done PGY1s, PGY2s, all of that. I recommend residency, fellowship, postdoctoral education to everybody. But I am very much cognizant it may not be for everybody. And just because it may not be for you does not mean that you are subpar, you are a failure, you what have you. I convinced myself I was subpar because I was not in the space in my life to do a residency. I still got to where I wanted to be. Yeah. So regardless if you pursue postdoctoral education or not, the choice is completely up to you. Success is not linear at all. Success is not linear. You can do whatever you want to do in your career if you are willing to fight for it.
Right.
You gotta fight for it. It's not gonna get handed to you. You have to fight for it.
One thing I like to tell my students is, as pharmacists, we tend to all be type A. That's just the pharmacist. But also understanding that I don't want to, okay, I'll just say it. It's not, we're just here. Like, he has a journey for all of us already planned. Like, it may not go the way that we think it should go, and it may not happen when we want it to happen, but God puts things in place to happen when they're supposed to. And you may not understand it at that moment, but it all makes sense. At the very end, it all makes sense because everything comes together. So just trust the process.
And I think, a lot of times what we're seeing as obstacles or doors closing are purposeful. So, when I moved to New Orleans, I'll be honest, that's not what I wanted. After my postgraduate training, I wanted to move back to New York City. I had a job lined up. Literally, if I had interviewed just a couple of days earlier, I would have had the job. But because I interviewed a few days later, they pulled the funding for the position. So I was back to interviewing. So when I took the job at Xavier, I didn't want to try out a new city. Honestly, I went to an HBCU. I was like, I don't want to work at an HBCU. I remember FSU used to get financial aid on time and FAMU used to get it a little later. I didn't want to be in that scenario. That move to Xavier was the best thing I could have done as a first position. I was one of very few HIV clinical pharmacists in all of Louisiana. I was at an amazing institution. I was starting to get consults from all the different institutions around the city. I was like, first of all, I work for Xavier and I work for this one clinic. Why, so I was appointed to 2 board, both the board of HIVMA, the HIV Medicine Association, as well as the board of directors for a local FQHC. These are opportunities that you don't get, first job out of your postgraduate training. And so here I was thinking, like, why am I not back in New York? But I love New Orleans. You talk to people, sometimes they're like, are you from New Orleans? I'm like, no, I just spent time there. The city just, took over my heart in a sense. So a lot of times God, in my opinion, is, even if you're kicking and screaming, he's like, I know you want this, copper over here, but I got gold over here, and I'm just trying to get you to the gold. If you would just stop kicking this, I take you to the gold. And I've seen that, multiple occasions. That's just one example. So I think also too, and I'll say I'm the worst at trying to reframe an obstacle into something positive, but I think it's so imperative for us to, remember that sometimes a door is purposely being closed for you, and it's either for you to grow and be ready for the opportunity when it comes, or it could be because there's actually something really much better. I'll give the other last example and then go from there. I was really interested in a position, and trying to make it work, it would have required me to relocate to a different country, but I was like focused, and it didn't work out despite best efforts from my end, best efforts from the hiring manager's end. And instead it placed me in a position where I actually got into a position with more reach. I didn't have to move. I got a pay raise. All these things came, and here I was again, like focused on, the copper, if you will, over here. And, instead there was gold, like, to be found. So reframing like obstacles can also be very helpful. It's hard. You got to talk to mentors about it. Mentors will help put things into perspective for you, because they're probably speaking from their own obstacles that now they're on the other side of and can see, that reflection. So just try to keep that in mind. Not every obstacle now is, door. Some people just don't have, your best interest heart. And that's when you group in with, like this great circle we have here. It just, feeds my soul to know that, there are people just like me, doing great things, marvelous things. And, so just keep that balance as you're navigating through your career.
I'll just put like a little plug for Peels and our Protege coaching program. I'll let our director of programs kind of give a little insight about it, but I'll put a link to the application. Dr. Onye, you want to talk a little bit about our coaching program?
Sure, definitely. Or Justina, let me ask you first. Justina was our interim director this year. Let's give her a round of applause.
Hey.
But I can go if you don't want to.
I'm gonna let you have the floor.
All right. Yeah, our program, our Pharmacy Initiative Leaders Coach Program, the application, Martienne, the early stage is already done, correct?
No, it actually ends in 3 days.
Okay, so if you're a P4 and you're looking to get one-on-one coaching to get, a residency or a fellowship, definitely apply. Martienne put the link in the chat. I think also Justina put a little plug. P1 through P3 program will be coming up soon. Maybe not this year, but maybe next year. So stay tuned for that. But yeah, it's a program that really you have to apply. If you get an interview and you are accepted into the program, you are assigned a coach, and the coach works with you all the way up until the match. And so we help you with CV review, mock interviewing, case presentation, your regular presentation for interview. So whatever you may need help with coaching in terms of just, what jobs you might want to do if it's not residency. So, just apply and, good luck. But also we do have other opportunities that students can partake in, even if you don't get into the program. So stay tuned for our webinars. The wonderful Dr. Chandler Scheck-Snyder, he is over our ambassador community. And so we have a lot of webinars that come through there as well. So stay tuned as well. And thank you all for coming.
Thank you so much, everyone. Above all else, we really do love to see it. I'm honored to have been the host and moderator for this panel. Thank you so much to everyone who tuned in for this webinar. You are greatly appreciated. Each and every one of you is appreciated. And remember to go out there. If a door doesn't open, sometimes it's not meant to open. Sometimes it's meant to redirect you. Or as my mom used to say, if a door doesn't open, you can kick it down. So, like, with that being said, thank you so much to everyone, and you have a wonderful night.
Here, everyone.
Bye.
Thanks for joining.
All right. Thank you so much, everyone. I think it went great.
No, I absolutely agree.
Yes, I was kind of nervous.